She's one of our American Heart Association BLS instructors, and today the two of us, we're going to go through and do a BLS and a CPR skills review. And before we begin, let me just ask you a few questions. What is the rate? How fast do we compress? And if you know the answer, it should be 100 up to 120 compressions per minute. We want to minimize interruptions to no more than 10 seconds. So that's right, regardless of what's going on in that room, if that person's in cardiac arrest, we need to get back on that chest and start compressing. Actually allowing the chest recoil, full chest recoil. So whenever you compress on the chest, when you compress on that heart, you squeeze the blood out of the heart. You circulate the blood. When you allow that chest to go back to its normal position, allowing full chest recoil, you allow the heart to refill with blood again. So these are some of the components of high quality BLS or CPR that if you're an instructor, you should really be emphasizing these things in your classes. Let's talk about making sure the scene is safe. If the scene is unsafe, you will not approach. You will call 911 from a safe distance and then make sure that, if you can get the person to safety, by all means do so. But the most important person to keep safe in that moment is going to be yourself. Let's talk about CAB. Historically, all healthcare providers know about ABC, airway, breathing, and circulation. And that's fine. We could have a person who is decompensating. Their blood pressure could be 60/40. We're going to focus on airway, making sure that we have the oxygenation. Usually our saturation should be anywhere from 99 up to 99%. We usually don't have the oxygen at 100% because it could be too much oxygen. But at the point where that person becomes unresponsive and pulseless, you check the carotid pulse for no more than 10 seconds while simultaneously looking for chest rise or breathing. At the point where the person becomes pulseless, our focus is no longer ABC. Our focus is CAB, circulation, airway, and breathing. You've called for the code. In the immediate moments, there's still oxygen in the bloodstream. It's just not moving. It's not circulating. So whenever you start doing those high quality chest compressions, you're moving the oxygen in that's already within the body, and you're helping to save that person's life. What organs are you trying to save? Make sure your students understand this. Okay, so the main organs are, of course, going to be the heart, the lungs, but don't forget the brain. So for every 1 minute that someone delays in starting CPR, an adult loses 10% of their brain function. So we want to make sure that your students utilize the skills that you're going to be teaching and that they are comfortable actually performing the skills. What does the AED do? The AED is the automated external defibrillator, and it sends energy through the chest wall. And the job of the AED is to organize or to normalize an abnormal heart rhythm. So we're trying to get that heart back perfusing again. Can you use the AED on a pregnant mother? Yes. If you don't use the AED and mom's heart is just quivering, is not contracting, what's happening to the blood flow to the baby? The baby's not getting any blood flow. So we can lose both of them. So it's really important that if it is a pregnant mother, that you do use the AED on that mother. And of course, if we're in a hospital or a place that can actually deliver the baby, we're going to prepare to deliver that baby within 5 minutes via cesarean delivery if we cannot get that mom's heart restored. All right, so that was a quick review. Kim, come on up. All right, and so everybody, we have our mannequin here, and you know that if you're with the American Heart Association, the mannequin should have 2 feedback devices. One feedback device is in the chest, and when you compress deeply enough, you're going to hear a click. The other feedback device is going to be in the shoulder, and that's going to allow you to keep track of your rate. I hate to say this, but red means dead. If you're compressing on the mannequin and you see a red light, that means you need to speed up. That means that you're not even anywhere near compressing at 100 up to 120 compressions per minute. The goal is to get the 2 flashing green lights, but because it hurts, sometimes we go too fast. When we go too fast, you're going to get an orange light, and that orange light is going to tell you to slow down. Right. Because we're doing an instructor renewal course, and I'm reviewing your skills, I want to show students how to do it the proper way, but then I'm going to intentionally make mistakes because I want you to give me feedback, okay? And so for you all, the difference between feedback and debriefing. Feedback is in real time. Do not allow your students to compress with their hands in the inappropriate position or at the inappropriate rate, and then at the end of their 5 cycles, be like, oh yeah, you did that wrong. So feedback is in real time. Debriefing, and this is going to help you with your instructor exam, debriefing is after the mega code, after the multiple team or the multidisciplinary team scenario. And whenever we are doing a debriefing, it is not instructor-led. It is student-focused. And so I ask you questions such as, what do you think went well? And I will let you all evaluate yourselves, and it's never an instructor pointing at a student, because they're gonna learn better if they can rationalize it and understand it. Before we get started, would you just bring one more thing, that AED, all the way in the back? Thank you.
Sure.
All right, so what's going to happen initially is that I'm going to be providing high quality CPR, doing what I'm supposed to do. And then you'll come and bring the bag. We'll have a 2 rescuer demonstration. And then from there, we will utilize the AED. All right, so I'm going to make sure my scene is safe, looking left, looking right. I'm going to check for responsiveness. Hey, are you okay? Are you okay? No response. At this point, I immediately call for help. Hey, you, call the code. Hey, you, call 911 and come right back. All right, and so what would be a reason that a person is unconscious but still alive? Unconscious, they're not responding but still alive. It could have been a head injury, a drug overdose. It could be diabetes. So everybody who's unresponsive does not need CPR. But regardless, you have to call for help, because we don't know at what point they could actually lose their pulse, okay? So help is coming. If you think about your facilities, it may take the fastest CNA a minute to run down, get the crash cart, and then come back into your room. So you're by yourself without any equipment. You do not have to provide mouth to mouth in those moments. There is no barrier device that we have right now that will prevent you from either spreading COVID or contracting COVID. So you're going to focus on hands-only CPR until your team member comes with the crash cart. And whenever Kim comes back, her imaginary crash cart has her bag mask device, and then we also have an AED. Hand placement. Don't compress on the very end of the breastbone, which is the xiphoid process. Don't compress on the throat. I love it when I get those older nurses in here, and I'm an older nurse too. I've been doing this for 25 years now, and they start doing like intercostal. They start doing measurements. Look, most Americans are too fluffy. You won't find ribs on us unless you have an x-ray device. So my rule of thumb is expose the chest, pretend to have a perfect nipple line, and place your hands in the center. Oh, one more thing I want to say about our classroom setting is that we usually train nurses, and so therefore we use our tables as simulated hospital or medical beds. As an instructor, you need to know what environment or what profession you're going to be teaching, and if you're teaching teachers, if you're teaching firefighters and paramedics, well then of course your scenarios will be practiced on the floor. All right, so here we go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. The next time I get to 30, I want you in position. Come on, get on there. 1, 2, 3, 4. How should the head be? What technique are you using? 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Good job. Good job. All right, and so I'm going to pretend, if you'll come over here and start doing your compressions. And so if it's just 2 rescuers,
Go ahead and start.
and your hand placement right here, go ahead and compress. Count for us.
4, 5, 6.
What does that orange light indicate? Don't stop, just
Too
slow
fast.
down. Keep going. Got to count so they can hear
5,
you.
6, 7, 8, 9, 10, 11, 12, 13,
Great
14,
job.
15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26,
Keep
27,
going, no
28,
breaths, keep
29,
going.
30.
1, 2, 3, 4, 5, 6, 7, 8, 9, keep
10,
keep
11,
going.
12,
13, 14, 15, 16, 17, 18, 19, 20.
21, 22,
Great
23,
job, Kim.
24, 25, 26, 27, 28, 29,
Keep going.
30.
1,
2, 3, 4, 5, 6.
All right, stand back for me. Everybody clear?
Do not touch the patient.
When this is charging as a healthcare provider, I'm going to go back and do some more compression.
Shock
Okay.
I'm
advised.
going to do some now. I can touch while it's charging.
5, 6, 7, 8, 9,
Stay
10,
clear of the
And I'm going to
patient.
move when whenever it flashes. 15, 16,
Do
17.
the shock now.
Everybody
Press
clear?
the orange button now.
Our AED is flashing.
Okay.
Shock delivered. Begin
Position.
CPR.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Great job. Great job. All right, so everybody, the tone that you hear right now is called a metronome. And the metronome helps you keep the pace. And so whenever you're compressing, you should be compressing to this tone. If you go too fast, slow it down to match this. For classroom purposes only, I'm turning off my AED. I don't like speaking over it, but it's really important for you to let your students know that you're only turning this off for classroom purposes, because your students will do exactly what they saw you do. They will turn off the AED. When would you turn off your AED?
You will turn it off once, someone arrives.
Okay, so when someone with more help
Yeah.
comes, we may not turn it off, but let's say you're in a nursing home,
Mm-hmm.
well then it's like a transfer of levels.
Right.
And
then
so-
once they take over.
Yes,
Right.
once they take over. And so this is what I like you to think of. Even if the person achieves ROSC, that means they're back alive. Do not turn off your AED, because the person who regained a pulse can lose a pulse. And so this is gonna reanalyze every 2 minutes, and it's gonna say analyzing heart rhythm. We cannot touch when the AED is analyzing, because it will analyze our heart rhythm, so we're interfering with analyzation. But we can touch in the interim when it's charging.
Mhm.
The shock will not be discharged without a human, so it's safe to touch while it's charging. Just make sure you clear everybody
Right.
before you actually press the shock button. What questions do you have about the use of the AED?
Nothing at this moment.
Okay, all right,
Nothing comes to
so,
mind.
great job, go team. And if you all have any questions, feel free to put those questions in the description or the comment area. And then after the class, I'll go back and I'll review those questions and I'll answer them for you. Let's talk about helping somebody who is choking. So if someone is choking, you want to, if someone is choking and they're able to cough, you want to encourage them to cough. However, they're making the universal choking sign, which some kids may not know this just yet. They're making the universal choking sign, or they're not able to get any air exchange out. You're gonna go behind them. You're gonna take the knuckle of your thumb, go above their belly button. You're going to cup, and you're gonna do upward thrust until the object is relieved. If the object doesn't come out, they're gonna become unconscious. And whenever they fall, you're going to support them and take them to the ground, and you're gonna start CPR. You would look for the obstructing object whenever you would give a breath, whether you're going to give a breath or not. After your 30 compressions, open up the airway, look for the object, and if you can see the object, you can use your index finger for children and adults and try to sweep the object out. We'll get to infants in a few moments. Think of the size of their airway. If you're trying to clear out an infant's airway, I would recommend you use your pinky instead of a bigger finger.
Okay.
That was adults. All right, so I'm gonna do this wrong, and I want you to give me feedback.
Yes, ma'am.
Okay. Hey, help, somebody help!
Okay.
What didn't I do?
Okay, first you were supposed to secure the scene.
Okay, so look
Make
left
sure
and right.
everything is safe for you to, go in.
Okay,
Okay, then you're supposed to check for a pulse and breathing.
oh, I just can't start chest compressions?
No, you shouldn't do that. No.
All right, so I need to actually assess to make sure the
Assess them
person's
first,
alive.
right.
All right, so I'm
So
sorry.
you're
Let's-
checking for breathing and a pulse, and you're
Okay.
trying to do it as fast as
Am I
possible.
checking the radial pulse?
You can check carotid here.
Carotid
Yeah.
pulse, okay. And I do this for like 2 seconds?
You can do it in about 10 seconds.
About 10 seconds,
Yeah.
okay. All right, I don't see anything.
Okay, so.
Hey, you call 911, bring me the AED,
Yeah, that's fine.
and I can start now?
As long as you don't have a pulse and no breathing.
No pulse, no breathing.
Okay.
Okay.
Go ahead and start.
1,
The
2.
faster you start, that's not the right.
That's not right?
No, ma'am, you need to come up some around here. and
Okay, so I want to avoid this
You
area,
want to
right?
avoid the xiphoid process,
Okay.
correct?
1, 2.
A little bit faster. You want to look for, there you, well, now you're going too fast. Slow it down a little
Do
bit.
you want to count with me?
Yes, 1, 2, 3, 4, 5, 6, 7, 8, 9.
job.
Now you're doing good.
All right, and so we're laughing and we're having a fun time, but whenever you have your students in the class, I had a nurse in the class quite recently who had not had a hands-on course in a long time. So all the stuff that we're laughing and joking about the feedback, you're really going to have to do this with your students because they've been taking virtual courses. And so I usually show them some skills before we even press play on the video, because I want to make sure that once we do press play, my students can compress, activate the feedback devices, and that helps to keep the class more organized. All right, so when the AED comes, I'm supposed to turn it on first, right?
Well, yes, you can turn it on,
Okay, and then,
but put it together. Oh, turn it on first and it will direct you.
yep, turn it on first.
Right. And it will direct you.
Apply pads.
So this pad goes
Patient's
here,
bare
and
chest.
that pad goes
Plug
there.
in pads
You can
connector
do
next to
Look at the red,
flashing
look at
light.
the red.
Right, but you're supposed to, you're doing it kind of wrong.
I'm kind of wrong,
Yeah.
okay.
So here, sorry about
Apply
that.
pads.
All right,
Plug in
Good.
connector.
It says plug in the connector.
oh, okay, I'm sorry, I'm nervous.
Analyzing heart rhythm. Do not touch
So
the
you don't want to
patient.
touch it, you want
Okay,
it clear.
everybody's clear?
Shock advised.
Okay.
Do I just keep looking at him?
No, you'll do the
Charging.
shock. No, you'll do the shock.
Okay, I'll do the
Stay
shot.
clear of
So if I'm a
patient.
healthcare provider, I could go back and do compressions when
Deliver
it's started.
shock
Yeah, you can
now.
do, you can,
Press
right,
the
Everybody
orange
clear?
press the
button now.
orange button.
Shock delivered.
But while it's analyzing, you can do compressions,
Begin
just so you
So
know.
we'll make sure we restate that.
Okay, you go. 4, 5, 6, 7, 8, 9, 10, 11, 12, 13.
Alright, very good. I'm gonna
Right.
turn this off for classroom purposes only, and I just wanna just restate what was stated
Okay.
earlier. We cannot touch while it's analyzing.
Right.
We can touch while it's charging, okay?
Right.
And then we have to clear everybody again before we press the shock button, okay? So I'm gonna turn this on again for classroom purposes. When it says analyzing, you say clear. When it says shock advised, charging, you say compress, okay? Pill and stick,
Apply pads to patient's bare
pill and
chest.
stick,
Plug in pads connector next.
connect,
Analyzing heart rhythm.
No,
okay,
Wow.
what's
Do
that
not
one
touch
word?
the patient.
Clear,
Clear.
okay?
Shock advised.
Can't stare at dead people, say
press
compress,
compression.
and don't move me till it flashes.
Stay clear of patient. Deliver shock now.
Okay, stand
Press
back.
the orange button
Okay, now
now.
you can get
Everybody's
everybody
clear?
Shock delivered.
And what do we do immediately?
You stop.
Begin
Okay.
CPR.
What's the name of that tone? Metronome.
Yeah, metronome.
Okay, what's the purpose of the metronome?
You can also go by that to, do the compressions, like use that same beat.
Okay, so it helps you keep your pace.
Yes.
I'm turning my AED off for what purposes?
Classroom,
Classroom purposes
right. But
only.
normally you can keep it on.
Yes, very good, elbows, that's our new high five.
Yes.
Woo! All right, so now we're going into child CPR.
Okay.
And according to the American Heart Association, a child is from 1 to puberty. And so I always tell my students, my son is 10, he is 5'2", I'm only 5'3", so he's 5'2", and he's 120 pounds. Is he an adult or a child?
He's a child,
Presenting as an
adult, right.
So I need
So
for you
you can
still
still
compress
do- right.
2 inches,
Exactly.
use 2 hands. Nothing's really going to change,
Right.
except for if it was a true child, one who had not reached puberty yet. What would be the reason for their cardiac arrest? Is it their lungs or is it their heart?
Usually they're hard.
Mm-mm.
They're lungs.
Usually it's a respiratory
Right.
condition. So maybe they drown. If it's a smaller child, maybe they put something in their mouth. So with children, it's really important that you prevent those accidents.
Okay.
If we can prevent those accidents, we can prevent the cardiac arrest.
Right.
Now with the child, and if it's 2 of us, and let me go back, you can use 1 hand on a child. I don't have the upper body strength.
Right.
So I'm not gonna use 1 hand on a child. On an infant, we can use 2 fingers or the 2 thumbs. But this is a child now, someone who's not reached puberty. I know I don't have the upper body strength to compress 2 inches with 1 hand. So
You can
even
still-
on a child, you can use 2 hands whenever you're providing those high quality compressions. If there are two of us, our ratio will no longer be 30-2. It's going to be 15-2. And the reason is so that we can actually maximize, give more breaths. So when you count it out, if you change your compression ratio for to rescue a child or infant CPR to 15-2, you end up giving double the amount of breaths within the same time frame. All right, so let's go ahead and put the mask on. We're going to pretend as if this is a child victim. So yep, same exact device. Don't forget, angular portion goes towards the bridge of the nose. I need you in place, and I need you to keep that airway open. You don't want to have to intubate the baby, so go ahead, or the young person. All right, keep the airway open. Let's go. 1, 2, 3. Keep it open. 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Then hover. Give a good breath. Good job. I heard that one. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Half squeeze. Okay, let's trade places. We have 10 seconds. 9, 8, start compressing while I get in place.
1, 2, 3,
Lock those elbows. Think too fast.
8,
9, 10, 11, 12. Perfect. Hover, hands up. 1 and 2. Let's go again.
1, 2, 3, 4, 5, 6, 7, 8,
9, 10, 11, 12, 13, 14, 15. Give my 15th one. 1 and 2. Great job. What questions do you have about child CPR?
Nothing right now.
Single rescuer, what's the ratio? If you're by yourself?
If I'm by myself, it'll be 32.
30-2. Okay.
But with two people, it'll be 15.
And what's the reason?
To keep that airway, get the breaths in for the lungs, because with children, it's usually lungs.
Yep, and then they breathe faster than adults.
Adults.
All right, awesome. Would you please bring the infant mannequin and also the infant bag? Oh, poor baby, poor baby. All right, and so, as we just discussed, if an infant or child goes into cardiac arrest, more than likely it was his or her lungs. They maybe put something in their airway. So we're gonna start off with how to help a choking baby. Pretend I'm sitting down. Someone's like, well, my instructor taught me to be seated whenever I'm trying to help a choking baby. What if there are no chairs? So, so you can sit down if there's a chair, but for our scenario, we don't have a chair or we're panicking right now. So tell me what you'd have me do to help a choking baby.
To have you
So if you can talk to me as an instructor, I try to talk to everybody versus touching them. So
Okay.
tell me what to do.
So I would first look and see if you can see anything.
Okay, I don't see anything.
Okay, and you know for a fact that they're choking, so you don't see anything, so I would turn them and then kind of slant,
Okay,
And
what's
I
the
would
purpose of slanting?
just so if it come out, it come out,
And I'm allowing what to help?
gravity.
Gravity, okay?
And then you're gonna, the back, you'll hit it upward,
Like this?
upward. I would use my palm upward,
Okay.
right, and thrust
One
5.
time. 5?
Yes,
1, 2, 3, 4.
5.
That looks so brutal.
I understand, but you want them to be able to breathe. That's
Okay.
more important than what you're
We
doing.
can
You wanna
repair
get it
that
out.
later.
Yes,
Okay,
yes,
so
take care of that.
5 back slaps?
Yes.
1, 2, 3, 4, 5.
Now I will turn them over, see
Okay.
if I see the object.
I don't.
Okay, I will do it again.
Okay, so now it's chest thrust.
Right,
Okay, so 2 fingers, center the chest, and you
Right.
press down. These are not compressions because the baby's still alive.
exactly.
Okay.
So you'll kind of go up, but still,
Mm-mm.
just go
Straight down.
Okay, straight down.
1, 2,
And I will do
3,
5.
4, 5. Do I keep doing this?
Well, I will check. Keep doing it.
1, 2, 3, 4, 5. 1, 2, 3, 4, 5. I think I see it. What do I do? Which finger do I use?
I will use my smaller finger.
Okay,
Got it. Oh,
got it.
wow.
Now. Oh, no, 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 no. Baby, stop moving. Baby's
Okay.
not breathing.
Okay, so you, no pulse and no breathing?
So, hey, baby. For an infant, everybody, you check the brachial pulse. And I'm checking for breathing for no more than 10 seconds. There's
Right.
no breathing, there's no pulse.
So I will begin CPR.
So we always gotta call.
Call.
We're gonna call for help, call for the AED, call for the emergency. If you're in a home, you're calling 911, you're in the hospital, you're calling a code.
Right.
But there's 2 of us, you just happen to be there with a bag. So if you're by yourself, it'll be 30 compressions followed by 2 breaths. And whenever you're performing mouth to mouth on an infant, it's not actually mouth to mouth, but it'll be mouth to nose and mouth. But because I train so many healthcare providers, we usually don't use our mouth. We're going to provide hands-only CPR until our partner comes with the bag mask device. My partner just happens to be here, so you're gonna go ahead and get in place. We're not gonna open the baby's airway too much, just do a slight tilt, all right? Get a good seal, and when I get to 15, you give those 2 breaths. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Good job, good breath. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Great job. Let's switch places. We have 10 seconds to switch. That was the end of 2 minutes. You can start without me. Go ahead and go. Gotta count for me.
4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15.
Perfect. Then lift up the thumb so I can see. 1 and 2.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15.
Okay, don't go any faster. Stop going too fast. Let's do it again. And you don't have to take your whole hand off. Just lift your thumbs.
Yes, ma'am.
Okay, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Great job. 1 and 2. I'm going to go ahead and put this AED on. You keep compressing. Go ahead. Pretend we have somebody giving breaths there.
2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13,
Patient's
14,
bare
15.
chest.
Okay, lift those
Plug in
thumbs.
pads
Keep
connector
going.
next to flashing
1, 2,
light.
3, 4, 5, 6, 7, 8, 9, 10, 11, 12,
Apply
13,
pads.
14, 15.
Plug in connect. Analyzing
Everybody stand
heart
clear.
rhythm.
Analyzing.
Do not touch the patient.
If it says shock advised, go back and do compressions, please.
Shock advised.
Compressions, I'll tell you when to clear.
3, 4,
Charging.
5, 6, 7, 8, 9.
Stay clear of patient.
Okay?
Deliver shock now.
I'm shocking
Press
number
the
3. 1,
orange
2, 3.
button
Everybody's
now.
clear?
Shock
You
delivered.
gonna take over airway?
Begin CPR.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Great job. Elbows. All right, so everybody, I'm going to turn this AED off for classroom purposes only. And if you are an American Heart Association, an American Red Cross, an American Safety and Health Institute, or if you're just an instructor, or if you're just interested in taking instructor courses, I have a playlist that has a whole bunch of training materials that will assist you. We just want to make sure that we're having the very best instructors out there training the community. Right now, the survival rates before the pandemic, out-of-hospital survival rates from sudden cardiac arrest were about 15%. Post-pandemic is 10%. So it is really important that you go out and you teach CPR in the community, and that you also are really teaching students how to save lives. It's not about making the most money. This is about patient and community safety. So again, this is Eunice Mathis. If you enjoyed the video, you can give me like coffee by like doing like the Super Thanks thing. I love coffee. So any support that you can give, whether it's sharing the video, subscribing to our channel, I appreciate you. And our website is flsinfloridatraining.com. Have a great day, everybody. You gonna say bye to him, Kim?
Bye-bye. Thank you.